a stress fracture is a tiny crack in the bone, and stress fractures are more common in the weight-bearing bones of the lower limb, so the leg and the foot. It arises from repetitive trauma to the bone, so it's an overuse injury, and it's more common in running and sports that involve a lot of jumping. It can, however, arise from normal everyday use if you've got a condition that weakens the bones, such as osteoporosis. So what causes a stress fracture? Stress fractures are an overuse injury, so they typically arise from increasing your training too quickly and doing too much too soon, essentially. Other than this, it can also arise from poor footwear, poor foot biomechanics, or an injury elsewhere in the foot or leg that causes compensation and overloading in that area where the stress fracture develops. What are the symptoms of a stress fracture? At first, the pain can be quite mild and you might not even notice it, but over time, as the stress fracture worsens, the pain associated with it will increase with activity and decrease with rest. There should be quite a specific location of the pain, and that's right where the stress fracture is. How is a stress fracture diagnosed? Initially, it's diagnosed by your GP or podiatrist, who will palpate the area and perform a physical examination, and they should have a pretty good idea of whether a stress fracture is forming there. Generally though, they will need to send you for either an X-ray, MRI or bone scan to confirm the diagnosis. What are the treatment options for a stress fracture? So initially you need to rest the stress fracture from any activities that exacerbate the pain or symptoms. If you fail to rest it, then the stress fracture may progress to a full-blown fracture, which is a lot worse. Often a moon boot is required to rest the area, so you can still get around but using the moon boot. Other than this, you'll be advised on footwear, stretching and possibly orthotics if poor foot biomechanics are a factor.